Iron deficiency can mimic perimenopausal symptoms, and HRT is not the solution. It goes undetected by doctors, and many women underestimate its impact on their quality of life. Globally, 1.2 billion people have iron deficiency, and at least twice this number for iron deficiency without anemia. Both are common in women due to menstrual cycle bleeds, and 2 out of 5 non-pregnant women are affected. Women in perimenopause who experience heavy periods, have uterine fibroids or excessive blood loss, or are on a vegetarian diet are at increased risk. And if you're an active woman like me, you can actually lose iron through sweating, especially if you live in a climate like Asia where it's really hot. In addition, high exercise intensity can lead to hemolysis. That's when your red blood cells split up. Although this isn't dangerous, it can increase your need for iron. Anemia is pretty easy to detect from a low hemoglobin level. The WHO sets this at less than 130 grams per litre for men and less than 120 grams per litre for women. But these levels are normal in people with iron deficiency without anemia. So the problem is that these people are walking around with chronic symptoms that can affect their quality of life. Some women may be living with it for decades, and they may be misdiagnosed with depression, chronic fatigue syndrome, burnout, an underactive thyroid, or they may just feel like they've aged. And also, you guessed it, perimenopause. In addition, you can also experience symptoms of hair loss, poor sleep, poor memory, restless legs, muscle or joint pain, and exercise intolerance. It can also lead to poor outcomes if you have heart failure. And in women who need to have a surgical procedure, this can increase your risk of blood transfusions. But you won't miss this diagnosis if your doctor also checks ferritin levels or the transferrin saturation or TSAT levels. A ferritin of less than 30 micrograms per litre or a TSAT percentage of less than 20 indicates iron deficiency. Current guidelines recommend that even mild iron deficiency should be treated with oral iron supplements to optimize health. But please see your doctor before iron supplementation because iron overload can be toxic.